You know, many people have a lot of misconceptions about what the gym is really like. You see people of all different shapes and sizes in here. Come on along and I'll show you. There's a lot of different things you can do at the gym. I'm doing a little weight training, and as you can see, it's a great place to meet. Oh my goodness, excuse me for a minute. I see Dr. Jonathan Stine over there. He has research that shows that exercise really helps reduce the fat in the liver. Stine, how are you?
Oh, hey Susan, good to see you again. Do you know Livvy?
I don't know Livvy. Hi.
Livvy and I were just getting warmed up to do a quick, exercise session here in the gym. We're going to do an exercise session today that's really designed for anybody to do. You can do it at home. You don't need any special equipment. If you have some aches and pains, some mobility issues, this is really something anybody can do. I prescribe it to a lot of my patients, especially those who are living with MASH, even if they are overweight or living with obesity too. And it's evidence-based, and it's really effective to make your liver healthy, like Livvy.
We've got so much to learn. Come on.
Some of this is going to be based off of using resistance bands, and then also we can even use our body weight. So Livvy, I know we've been working on some push-ups, so we're actually going to start with some wall push-ups first. Session. Susan, if you want to join in, you can do regular push-ups on your knees, whatever modification you want. But for the wall push-ups, right, we're going to position ourselves, our arms outstretched in the beginning, keeping our body nice and strong with the core, and then we're just going to go in and out. To give us, 5 or 6 different reps. Good, all right, perfect. And Susan's doing her push-ups back here. Form looks excellent. So wall lunges are what they're described. They're actually on a wall here. So I'm going to put my feet about 6 inches away from the wall. Put my back nice and flat on the wall. I'm going to have my arms here at shoulder height, and I'm just going to move them up and down. Livvy's already jumping right in. I love the initiative here. Keep some shoulder exercises. Again, we can do this just with a band. We're going to get our band. And when you step on it, you want your feet about shoulder width apart. And we're going to make sure our knees are bent just a little. We're going to go ahead and bring the band up here, shoulder height, making sure our hands are facing out. We're going to push straight up. Next up, we're going to go ahead and switch to bicep curls. So again, keeping some tension on the band. We're going to keep our arms right here, pinched into our sides. We're going to move our arms up and down. Arms up and down. Be a squat, again, designed to work on our quads. You can do this standing freely, or you can do this on a wall. You're going to position your back on the wall. And when we squat down, we're just going to lean forward a little bit, just like this. Good. And just a little more forward, Livvy. Good, perfect. So Livvy, we're going to have you do some step-up exercises. All right, so just going to step up on one foot and back down. Now this is a little bit maybe tall for Livvy. Oh no, Livvy's doing great. Okay, I was a little worried there. We're trying to really challenge Livvy today and make sure we're pushing our best. So notice she's alternating feet. Good, all right. When we do this exercise, we're really going to think about pointing forward. So to keep your core nice and tight, we're going to put our left arm out, our right leg back. And here we go. All right, just alternate. Good, yep. Well done. Exercise, and then we're done with our circuit for liver health. So we're just going to sit on the bench, and we're just going to push our toes down and raise our calves up. You can do this standing if you want. You can do it alternating one leg. You can do balancing on a leg if you want. It really depends on what your mobility is. Perfect. It's evidence-based. It'll help your liver get healthier. If you do this over time, for anywhere between 12 and 16 weeks, you'll start to lose liver fat. And the great thing is you don't have to lose any body weight for this to work. Most people really, really want to lose weight. That's why they exercise. It's really hard to do. So if you just get more active, you're going to make your liver much healthier, just like Livvy.